This video is about the second postoperative visit. Again, this is meant to be used as a supplement, not a replacement. The main thing that happens on this visit, if the drains were not previously removed, is that they're removed. And if they were removed, obviously we continue with the daily washing, applying antibiotic ointments 4 times a day, and then putting on bras. I always tell my patients the most common time in my practice for hematomas, that's where you're bleeding internally at the site of the surgery, is between 1 to 3 weeks. So even though you might be feeling well, I want you to be very careful with your arm movements. Any excessive, sudden, jerky, heavy movement might cause tearing of the tissues inside. And if it's not your lucky day, it will start to bleed. And if it bleeds, it might turn into a hematoma, which is a large collection of blood internally, which will require an emergency surgery. So even if you're tempted, even if you feel great and you feel like you should be doing something, you got to think of that possibility. Doing something a little bit earlier is not worth the risk of having another surgery and the significant cost involved when you're having the emergency surgery at a hospital. One new thing I introduced on today's visit is touching your skin to ensure that skin sensation returns in a normalized fashion. As a result of your surgery, you will be experiencing many unusual sensations such as numbness, tingling, shooting pain, itching, which are all perfectly normal. However, as your body tries to repair that by growing in new nerve endings, if you never touch your breast, and that seems to be the common tendency, because they feel strange, most people don't want to touch those areas, that actually ends up in hypersensitivity, which can be very uncomfortable. So using the palm of your hand and your fingertips, there's not a specific way to do it, but I want you to just get in the habit of lightly touching all of the breast skin so that we don't develop that hypersensitivity. You can do it on bare skin, through your bra, shirt, jacket, sweater. It really doesn't matter how you touch that skin. And it is not a regimented, you have to do it so many times for so many minutes. It's pretty much whenever you have some time and privacy. I want you to get in the habit of touching them. I want you to continue doing that until you start questioning, why am I doing this? Everything seems to feel pretty much back to normal, which will usually take several months before you get to that point. After this visit, we're continuing with wound care. We're continuing with very simple, easy arm movements, nothing excessive, heavy, certainly not exercising yet, certainly not lifting heavy things. Most people can start to drive between 1 to 2 weeks after their surgery, as long as they're not taking their narcotic pain pills. But you have to use common sense. In the beginning, you shouldn't be driving long distances for long periods of time. Things will slowly get better. Breast shape will get better. You'll feel better. And the next time I'll talk to you is at 1 month mark.